Hello everyone, welcome back to my channel Dr.shil's Physio Victory. In today's video, we are going to cover 300 most important MCQs which are repeatedly asked in master degree entrance exam for physiotherapists and government exams for physiotherapists, nursing and paramedical exams. I will not only tell you the correct answer but also explain why it's correct and why other options are wrong. So keep a notebook ready. This video is pure gold for exams. Let's start. Today's first question is father of anatomy is option A Hippocrates, option B Herophilus, option C Leonardo, option D none. Here the correct answer is option B Herophilus. Herophilus is known as the father of anatomy. He was the first person to perform systemic human dissections. Hippocrates is the father of medicine and Leonardo basically made anatomical drawings. Next come to question number 2. Person lying on his or her face, chest and abdomen is said to be in option A supine position, option B prone position, option C anatomical position, option D lithotomical position. Here the correct answer is option B prone position. Prone position is the person lies on face. This is the image of prone position. Face is downwards, and this is supine position. Face is upward, feet towards the ceiling. Next, come to question number 3. Cadaveric anatomy is studied on option A artificial bodies, option B dead bodies, option C microscopic bodies, option D all of the above. Here the correct answer is option B dead bodies. Cadaveric anatomy means study of gross anatomy using human cadavers. It's helpful in understanding 3D relations, surgical anatomies and clinical correlations. Microscopic bodies are used in histology. Next come to question number 4. When tip of thumb touches the tips of any of the fingers is option A opposition, option B abduction, option C adduction and option D flexion. Here the correct answer is option A opposition or opponents. Movement where thumb touches fingertips. Next, come to question number 5. In which of the following movements the angle between articulating surface do not change? Option A circumduction, option B gliding, option C flexion and option D extension. Here the correct answer is option B gliding. Next, come to question number 6. The precapillary or postcapillary communication between vessels is called option A anastomosis, option B end arteries, option C tendon and option D aponeurosis. Here the correct answer is option A anastomosis. Anastomosis is equals to communication between two arteries or two veins. Tendon basically connects muscle to bone. Aponeurosis is flat tendons. Next come to question number 7. Increase in the size due to increase in the number of cells is option A hyperplasia, option B hypertrophy, option C atrophy, and option D aplasia. Here the correct answer is option A hyperplasia. Hyperplasia is increase in the number of the cell, basically seen in endometrium. Hypertrophy is increase in cell size. Atrophy in decrease in cell size. Aplasia is failure of development. Next come to question number 8. Which of the following bones is the first one to start ossification? Option A, ulna, option B, scapula, option C, clavicle, and option D, humerus. Here the correct answer is option C, clavicle. Clavicle is the first bone to ossify. And the 5th to 6th week of intrauterine life ossifies mainly by intramembranous ossification, and it is also the last bone to complete ossification. Next, come to question number 9. The axis of abduction adduction of finger of digits passes through option A center of second digit, option B center of third digit, option C center of fourth digit, and option D center of fifth digit. Here the correct answer is option B center of third digit. This is the third digit. Away from third digit is abduction, and towards the third digit is adduction. Now, one thing you should remember, it is DAB, dorsal interosseous, which helps in abduction, and PAD, palmar interosseous, which helps in adduction. Next, come to question number 10. What is the key muscle of axilla? Option A, pectoralis major, option B, subclavius, option C, subcostal, option D, pectoralis minor. Here, the correct answer is option D, pectoralis minor. Pectoralis minor is called the key muscle of axilla because it divides the axillary artery into 3 parts. Divides the axillary into parts. One is proximal, two is posterior, and three is distal. Next, come to question number 11. All of the following muscles are flexors of the wrist except option A, flexor carpi radialis, option B, flexor digitorum superficialis, option C, pronator teres, and option D, flexor carpi ulnaris. Here, the correct answer is option C, pronator teres. Pronator teres is primarily a pronator of forearm, not a wrist flexor. Flexor carpi radialis, wrist flexion plus radial deviation, flexor carpi ulnaris, wrist flexion plus ulnar deviation, flexor digitorum superficialis, finger flexion plus wrist flexion. Next, come to question number 12. Nerve supply of trapezius muscle is option A, axillary nerve, option B, accessory nerve, option C, radial nerve, and option D, subscapularis nerve. Here, the correct answer is option B, accessory nerve, spinal accessory nerve, or it is a cranial nerve. 11 is which have the motor supply to trapezius muscle and sensory supply to C3, C4, axillary nerve supply to deltoid muscle, radial nerve, extensors, subscapularis nerve, teres major muscle. Next, come to question number 13. The brachial plexus is formed in the option A, anterior triangle of neck, option B, near the head of the humerus, option C, wide around neck, wind around neck, option D, posterior triangle of neck. Here, the correct answer is option D, posterior triangle of the neck. Between the scalenus anterior and scalenus medius. This area lies in the posterior triangle of the neck. Next, come to question number 14. Largest branch of brachial plexus is option A, axillary nerve, option B, radial nerve, option C, ulnar nerve, and option D, median nerve. Here, the correct answer is option B, radial nerve, which is the largest branch, supplies all extensors of arm and forearm, runs in spiral groove of the humerus. Next, come to question number 15. Fracture of humerus at midshaft is likely to cause injury to which of the following nerves? Option A, median nerve, option B, radial nerve, option C, ulnar nerve, and option D, musculocutaneous nerve. Here, the correct answer is option B, radial nerve. At mid-shaft of humerus, radial nerve lies in the spiral groove. Next come to question number 16. Which of the following is a primary adductor? Will be adductor of shoulder. Option A, pectoralis major. Option B, teres major. Option C, coracobrachialis. And option D, short head of the biceps. Here, the correct answer is option A, pectoralis major. Pectoralis major is a powerful adductor of the shoulder. Also, it helps in medial rotation and flexion. Next, come to question number 17. Which of the following is most commonly fractured bone? Option A, scaphoid. Option B, lunate. Option C, trapezium. And option D, capitate. Here, the correct answer is option A, scaphoid. Scaphoid is the most commonly fractured carpal bone. Scaphoid fracture is a three-type fracture. This is distal fracture, this is waist fracture, and this is proximal fracture. Next, come to question number 18. Pisiform is a bone that grows under the tendon of option A, flexor digitorum superficialis, option B, flexor digitorum profundus, option C, flexor pollicis longus, and option D, flexor carpi ulnaris. Here, the correct answer is option D, flexor carpi ulnaris. Pisiform is a sesamoid bone embedded within the tendon of flexor carpi ulnaris. This is the image. This is tendon of flexor carpi ulnaris. This is pisiform bone. Next, come to question number 19. Which of the following is commonest site of injury of ulnar nerve? Option A, at wrist. Option B, lateral to pisiform bone. Option C, posterior to medial epicondyle. Option D, when it divides into terminal branches. Here, the correct answer is option C, posterior to the medial epicondyle. This is the image. This is the medial epicondyle, and this is ulnar nerve. Ulnar nerve runs behind the medial epicondyle. That's why it is also called funny bone. Next, come to question number 20. Cervical rib is a rib arising commonly from option A, C1, option B, C7, option C, T1, and option D, T12. Here, the correct answer is option B, C5. Cervical rib is a accessory rib arising from 7th cervical vertebra may cause thoracic outlet syndrome. Next, come to question number 21. Angle of Lewis is angle between option A, manubrium and body, option B, body and xiphoid, option C, manubrium xiphoid, option D, sternum and costal cartilage. Here, the correct answer is option A, manubrium and body. This is the part of sternums. This is called xiphoid process. This is called the body of sternum, and this is manubrium sterni. So now if I draw a line like this and this angle is called the angle of Lewis. Trachea bifurcate posterior to the angle of Lewis. You have to remember this. Okay, and it correlates with the vertebral level T4 and T5. And second rib articulates at the mediasternal joint. Next, come to question number 22. Which of the following is floating ribs? Option A 1, option B 6, option C 9, and option D 12. Here the correct answer is option D 12. So this is the image of our rib cage. 11th and 12th rib is floating rib. 11th and 12th, 1 to 7, 1, 2, 3, 5, 6, 7. This directly attached to the sternum. So this is called the true rib, and 8, 9, 10, which conjoin together and attached to the sternum. This is called false rib, 8 to 10. Next, come to question number 23. Which type of the bone is sternum? Option A, short bone. Option B, long bone. Option C, irregular bone. And option D, flat bone. Here, the correct answer is option D, flat bone. Sternum, rib, scapula, skull. These are the types of flat bone. Next, come to question number 24. The capsule of shoulder joint is absent on option A, posterior surface, option B, anterior surface, option C, lateral surface, and option D, medial surface. Here, the correct answer is option C, lateral surface. Shoulder joint capsule is weak inferiorly. Laterally, the capsule is replaced by the rotator cuff tendon. Next, come to question number 25. Winging of scapula occurs in paralysis of option A, pectoralis major, option B, pectoralis minor, option C, latissimus dorsi, and option D, serratus anterior. Here, the correct answer is option D, serratus anterior. Serratus anterior holds scapula against chest wall, supplied by the long thoracic nerve. Thank you everyone for watching this video. If you found the video is helpful, please share with your friends and please stay tuned to my channel for the next part of this video.